Okay, so this lecture is going to be an overview of different study designs, and this is all really important, so pay close attention. We will also go over each of these study designs in subsequent lectures. So this lecture is just an overview of all these different observational study designs. And we will talk about them more in depth in future lectures, but this is really kind of the meat of this class. So today, I just want to remind you that we are reading chapters 7 and 9 from our book, and we're going to talk about the different study approaches. So we are now on step 2 of our 5-step research diagram. We worked last week on identifying a study question. And so this week and in future weeks, we're going to work on selecting a study approach. So when we are thinking of doing a study, we do need to ask some questions. We ask things like, do new data need to be collected? Or can I use existing data sources? If I need new data, would an experimental study be required? Or can I answer the question in a non-experimental manner? Further, when we're thinking about experimental studies, we have to think, is this going to be feasible? Like, is it doable in real life? And is it ethical? We also have to think about our EDP framework. Is my question based primarily on exposure, disease or outcome, or membership in a particular population? And then we also have to think of the time constraints. So there are many different types of study approaches. There's the case series or the case study. There's the cross-sectional study, the case control study, the cohort study, the experimental study, which we're all pretty much more or less familiar with, a qualitative study, correlational study. We won't be discussing this one in class, but this is where you find that statistic. This is correlated with that. And then there's also reviews and meta-analyses. So we start by asking ourselves this question: will new data need to be collected? So if we need to collect new data, we would be doing a primary study or primary research. And this is the type of study that collects new data from individuals or groups. Then there would be a secondary study or secondary research, which analyzes an existing data set or existing health records. Then there's something called the tertiary study, and these are things that review and synthesize existing literature on a certain topic. So the first in our study designs is a case series or a case study. So here is an example of a case. This is a case series. So a case report or case series describes an individual or a group of individuals with a disease. There is no comparison group. This can be used to come up with a hypothesis to be tested in a future study. And more likely than not, it's about a new or emergent illness or a new or emerging treatment. And this is always primary research. It's always new data that's being collected and described. So this is a study about cardiopulmonary rehabilitation in post-COVID-19 patients. So there were a series of patients who had COVID-19, and they wanted to test, because COVID-19 was a new disease at the time, they needed to test new therapies, right? So they're doing a new therapy for a new disease. So they wanted to say, what kind of cardiopulmonary rehabilitation program works for post-COVID-19 patients, okay? In history, we've seen a lot of historical case series. This is a famous one from 1981, and it's a case series of a disease that wasn't previously on the radar, on the scientific radar, right? And so our case series or our case study, it's kind of a way to say, hey, everybody in the medical and scientific community, check this new thing out that we found. So this thing, June 5th, 1981, a new pneumocystis pneumonia kind of surfaced in Los Angeles. So in the period October 1980 to May 1981, 5 young men, all active homosexuals, were treated for biopsy-confirmed pneumocystis carinii pneumonia at 3 different hospitals in Los Angeles. 2 of them died. All 5 patients had laboratory-confirmed previous or current cytomegalovirus infection and candidal mucosal infection. And then they say the case reports follow. So what do you think this is the initial case report for? Well, it's HIV/AIDS, right? June 1981, we hadn't seen this before, and all of a sudden we're saying 5 young men between this not even a year time span with similar symptoms. Yeah, so this is just a continuation of that case series. So our next study design, so we just talked about the case series or the case report or the case study. The next one is called a cross-sectional study. Now, this is just a diagram that shows you what a cross-section is, so you can think about what a cross-sectional study might be. And no, it is not a study of a foot in cross-sections. It is a study that is kind of a cross-section in time, okay? So a cross-sectional study describes an exposure or disease status in a population at a particular point in time. And so this is important, a single point in time or a single defined period of time, okay? So imagine this foot is a clock. It's time. It's a really long time span, and you're just going to take a slice of that time span and see what's going on in that time span. You can see what's associated with what, right? You can see if there are people who have a certain disease and a certain kind of exposure at the same time. You can be like, ooh, this happened at the same time. But that's all you can tell. All you can tell is things that happen at the same time. And then this can be used to come up with a hypothesis that you can test in the future. And this can be primary or secondary research. So primary research, once again, is collecting new data. Secondary research would be using existing data sets or health records. So here is an example of a cross-sectional study. This one, let's see if they let me click it and let it play. Ooh, it does. So this one is, they wanted to know the association between consumption of ultra-processed foods and serum C-reactive protein levels. So they wanted to know, so C-reactive protein measures inflammation. And so they wanted to know if the consumption of ultra-processed foods was related with possibly inflammation in people. So they tell you that this is a cross-sectional analysis of another data set. So first of all, if we're looking at another data set, is this primary or secondary research? Well, it's secondary research because we're looking at another data set, okay? And they're looking at a period of time from 2008 to 2010. So they're looking at this data set and they're looking at results from 2008 to 2010 to see if consumption of highly processed foods is related to an increased level of something that measures inflammation. All right, so that was the cross-sectional study. Now we're moving on to the case control study. So the case control study compares histories in people with a disease, which would be the cases, and people without a disease, which would be the controls. So if I perhaps were to give you a question sometime and I said, listen, we've got this disease and we've got the history of people who have the disease, and then we've got this other group of people who don't have the disease, and we also have their history, and we're going to compare their histories. What type of study would I be doing? Well, I would be doing a case control study. Case controls, okay? This can be primary or secondary research. So if we have a case, we have the disease. Sometimes we use this for foodborne illness. So if we have people who have a disease, they have a tummy issue after eating at a picnic. Okay. Then we have other people who don't have a tummy issue. Did these people eat at the picnic? Well, we'll look back and see, well, most of these people didn't eat at the picnic. Most of these people did eat at the picnic. So we'll see, maybe the picnic has something to do with the disease. Then we go back and we look at each food that was served at the picnic, and we see which food caused or was associated with the most cases of the disease. Next, we have our cohort study. So that was our case control study. Now we have our cohort study. Our cohort study follows a cohort of people. Okay, so let's say we follow this cohort of people who has been exposed to a certain environmental, perhaps smoke from a steel mill. And all these people grew up around a steel mill, and we're going to see who develops the disease and who doesn't. We could also kind of compare that to a group of people who were never growing up around a steel mill and see who develops the disease and who doesn't. So that kind of it gives us information. So this compares rates of disease in people with different exposure histories, or follows a population forward in time to look for incident or new cases of disease. This can be primary or secondary research. So as you can see, we can look back in time, a retrospective cohort study, or we can look forward in time, a prospective cohort study. This is a diagram of looking forward in time. Here we can also kind of look backward in time. So let's say we want to go back to 2012 and see a certain defined population, see who develops disease as a result of a certain exposure or not. So we can go back in time, or we can start in the year 2024 and follow people forward in time for, 20, 30, 40 years. There's no limit to the amount of time you can study people in a cohort study. We also have an experimental study, and this is one that we're all more or less familiar with. We compare outcomes in participants assigned to an intervention or control group. And you can do primary research, right? You collect and analyze new data, but you can also use, now we have so much computerized data, you can use secondary research and do kind of modeling of outcomes and change your variables and see what happens. So here is a study. It's an experimental study, and it is experimental increase of blood glucose alters resting state EEG measures of excitation inhibition balance. Okay, so what are we doing? Well, we are finding people and we are giving them a glucose drink, and we are measuring their EEG. That's their kind of their brain waves. So they are going to be collecting data on people who either do consume a glucose drink or don't consume a glucose drink. And we're going to compare their EEGs after. So let's think about this. What kind of research is this? This is experimental research, but is this primary or secondary research? Well, it is primary research because they are collecting new data. Next, we have a qualitative study. So qualitative study, as we should have learned in previous classes, qualitative seeks to understand individuals and communities and how they perceive and make sense of their world and their experiences, right? So we have quantitative research, which is numbers. We quantify things, quantities, numbers. Qualitative studies seek to characterize the quality of something. How do you feel about something? What is your perception of something? So, and we can either do primary or secondary research with this. And here is a study, a qualitative exploration of fear of cancer recurrence in Turkish cancer survivors who were referred for colposcopy. So this is a study with a qualitative design based on an analysis approach They are looking at in-depth interviews. Okay. And as a result of the interviews, we identified 3 themes: fear, emotions associated with fear of cancer recurrence, and fear of being diagnosed with cancer. So, well, the 3 themes were fear of all different things, but that is kind of what you seek to measure in a qualitative study. We also have reviews and meta-analyses. These are syntheses of existing knowledge. So this would be if you have a topic that you're kind of doing, maybe for a class, you do these kind of studies where you compile what is already known. You collect a bunch of journal articles about a certain topic, and then you kind of report what you found out of those journal articles. Now, a systematic review is very systematic about the way the journal articles are collected, and which ones are included and which ones are not included, and how to analyze them and everything. But it is a valid study design. A meta-analysis is usually combined with a systematic review, and a meta-analysis is a numerical, a quantitative analysis of what you find in your systematic review. So this is tertiary research, right? So your tertiary means third. So you're 3 things removed from your primary research, right? So this is tertiary research, and this is an analysis of articles that have already been published. So here we have a systematic review of psychosocial nutrition interventions for young adults. And so let's see what they did. They searched on these databases: CINAHL, Embase, Medline, the PubMed, PsycInfo, Web of Science, and they found this many records. And then they tell you exactly what they did to select the journal articles that they're using to compile their data. So this is a systematic review. Is this primary or secondary research? Well, if you've noted the asterisk right there, you'll note that this is a trick question. This is tertiary research because you are compiling journal articles that have already been published and the data from those journal articles. So why are there so many study designs? Well, we've seen experimental studies, and we also have observational studies. So remember when we talked about experimental studies, we talked about, is it feasible and is it ethical? You have to think about these things because they're either doable or not doable, or they're either ethical or not ethical. We cannot put people in harm's way just to see what happens to them for scientific purposes. We can't do that. So if our study can't be done experimentally, either because it's not doable or it's not ethical, that's where we have all these other study designs. And we talked about those other study designs. Those are observational studies, okay? So this is from our book, and so we can look at, so they've kind of divided this into 4 different sections. So we've got our observational studies and our experimental studies, and that's what I was just talking about on the previous slide. Experimental studies are the only studies that are categorized as experimental. And the reason is because everything else is an observational study. You're just kind of studying and watching what happens. They have further divided this into descriptive and analytic studies. We can think of this as, do these have a comparison group? Yes or no? And these don't. These studies, the case series and the cross-sectional study, are only based on one group of people. You do not have a comparison group. You know how in the experimental study you have a control group and then you have your experimental group? That's a comparison group. Case control study, you've got 2 groups right there, a case group and a control group, so you can compare them. A cohort study you can also compare. So these are analytic. But right now, what I want you to just keep in mind is the difference between an experimental study and an observational study. And that's it for this lecture.